Hello, everybody, and welcome to my show. I'm your host, Diana Belleros, award-winning and best-selling author, Fire and Ice, The Journey of Transformation and the Light Within. You can find out more about me on my website, dianabelleros.com. And today we have a very special guest all the way from India. Welcome to my show. I cannot wait to learn about what's going on in India and what you have been doing. I know from your daughter you have been doing amazing things. Thank you so much for what you do. We need a lot of people like you, more of you in this world. So tell us about yourself and what you have been doing.
First of all, thank you very much, Dinah, for giving an opportunity whereby I can share my experience and my thought process with my listeners. Okay. As we all know, that the entire world is passing through a very difficult time. Rather, I should use the right terminology. It is a unprecedented difficult time, which history has very rarely such type of things has witnessed in the past. That is the thing, and I will be very happy to share my experience and what I am doing in order to address these issues, okay, in a small way or the big way, okay, as we are progressing with the program further. Okay, as far as myself is concerned, so let me tell you that I'm engineer and MBA professional, okay, and almost I have been working since last 35 years in the real estate and construction industry in various positions, out of which almost about 2 decades I spent in Dubai, and then the rest of the time I've been working in India. That is the overall this thing about me. Okay, my passion is of course my profession, and as far as that, some sort of social service and charity for the underprivileged section of the society.
So you have a lot of experience and you do a lot of work with people. You have community, you help community. You're part of your associations. Tell us, why did you decided to get involved when it comes with working with people and helping people? What made you do that?
Yeah, see, it's very simple. You see, first of all, that we are the member of the society, and each and every one has to put his efforts to make the society a better place for the living. Now the thing is that if you see this pandemic situation which we are exposed to, we have started a small initiative, and that initiative also it came into the picture when within my society one young person, about 38-year-old guy, he just died because he could not get the hospital at the right time. He could not get the treatment at the right time. He could not get the oxygen at the right time because everywhere, if you see that, there is a shortage of hospital, there is a shortage of hospital beds, there is a shortage of oxygen, there is a shortage of ambulance, and under this type of scenario, okay, one of the neighbor took him in his car to the hospital, and because of all those things, no beds was available and all those things, ultimately the person is died. This is the incident, which I mean, impacted our entire thought process. And me and my team together, we thought how to address this issue at our level. Because, see, most of the things it depend on how we conduct ourselves and the civic sense. Everything, nowhere, I mean, we can say that we can depend only on the initiatives of the government. Of course, the initiative of the government plays the major role on that. But being the part of the society, it is our moral responsibility as well to address this issue within our capacity. So we have decided that we can set up a small medical room with a basic medical facilities so that under such type of emergency, at least for the temporary basis, that some medical support system will be available in house. In order to do that, we have put up this proposal to our residents, and let me tell you, the sort of response which we got, our team has got, it was tremendous. Each and everyone has come forward to contribute, to help, and with their help, as a collective efforts, we could able to set up one small medical room within our society. We started this room with a single bed, with single oxygen cylinder, and that was also donated by one of the resident. And you'll be surprised to know that the resident who has donated that oxygen cylinder, he himself is a heart patient. And when I asked him that why this you are donating when you yourself is require this thing, and he told me that look, if because of this oxygen cylinder we can support somebody, I'll be more than happy. His requirement is not 24 by 7. And today we have expanded to up to 6 beds, 7 oxygen cylinders, one oxygen concentrator, oximeters, thermometers, BP instruments, and the entire facilities. In order to handle this entire facilities, we requested our in-house fellow doctors to support us. Very happily, they agreed for that. And today, since we have achieved this one, almost more than 2 dozen people of our society, they have taken the services of this small medical room. Now the thing is that it's not the question of if it's a 1 bed or 5 bed or 6 bed. It is a question of the initiative. After seeing this thing in our nearby area and lot of societies and condominiums, they came forward and they also decided to set up such type of a small setup within their society. Then let me tell you that where I live, the condominium, in and around at least about 500 condominiums are there. Now, if you see that, if every condominium just add 5 beds, we are going to have 2,500 bed, which is being totally controlled by the condominiums and their associated doctors. By doing so, we can always reduce the pressure on the government establishment and facilities. And the most important thing is that you see that something ready in hand is available to the residents where you are in need of that. You are in badly need of that. That gives the confidence to the people because you see the way the situation today is, lot people they are afraid. You see, okay, and especially the old age people, their main worry is that okay, today if I'm going to sleep, whether I can sleep peacefully or not. So this is small initiative. What I see, the way it is going to take the shape, it is really going to be beneficial for the society as a whole.
Good, very good. That's amazing initiative, and you made your apartment complex available for these people. And I know you are having a lot of people who, from what I found out, I have a friend. She has a boyfriend in Delhi, and she said some people even die in their cars, others die on the sidewalk, which is really tragic thing. And when we get together, when we get involved, and this makes difference, this helps save lives, like you said. And it looks like people are not afraid to come forward and help and do everything in their power. Even the doctors, can you tell us how you convinced all these physicians to come to the complex and start doing their job? How did you do that?
See, let me tell you one thing. Whether it is a doctor, physician, engineers, or whatever it is, your profession is, okay? Ultimately, when you are part of the same condominium, the part of the same society, okay? And the most important thing which is there, you see that the civic sense of the people, we all are educated, correct? Educations, you see, it provides us a vision, okay? that we should think about the welfare of the society. So when we approached these doctors and we told these are our initiative, because only putting up a medical room or medical basic facilities, it is easy that it can be put, but legally you cannot operate it unless until the doctors take these facilities under their supervision, because this is job of an specialist, and we being the, I mean, engineers and this thing, we are not the specialist on providing the medical assistance to anybody. Doctors are the right person. And when we have told this thing, immediately they agreed for that. And let me tell you, these doctors, they told we will be more than happy to serve our people whenever it is needed.
Wow, that's amazing.
Yes.
Absolutely amazing. So, what is your advice to the people who are in your situation right now, dealing with this? Some countries were able to take under control COVID-19 with the vaccines and everything, and with 6 feet distance and everything, but some countries still suffering, and they don't know where to begin, how to help, what to do. What is your advice for them?
See, my advice is very simple on this. Okay. Now, let me address your question in two parts. First is that the best thing is that you should do everything what is morally justified to assist your fellow residents, your dear and near ones. That is the first thing is that. Okay. In order to do this one, as I told you, because see, together we make the difference.
Absolutely.
So we should always remember together we make the difference. And on the basis of that, irrespective of the any geographical boundaries or this thing, it is a nature of the human beings that always for such type of cause they should come together, form a control group, go to the people, because you see in today's world the problem is that everybody cannot spare the time because they have got some other priorities. Okay. So whatever you can contribute in order to address this issue, whether your contribution is a monetary, where the contribution it is with, you can say, some equipments, where the contribution, whatever you want to do, okay, people they should come forward. Even planting one tree, that itself is a great service to the society. So everyone has to do his bit of work for the welfare of the society. Now, second thing is that as far the vaccination is concerned, I do agree with you that in entire world the vaccination is being done in a very high speed. Sometimes what happens, see, there is some misconception when we start comparing the country with one country with another country. Okay, and we say that okay, one country is there where the vaccination is done only 10%, another one country is there where the vaccination has done by 50% or 40%. Okay. In my opinion, this sort of comparison, it is not logical and it should not be done like this. Just to explain this one, let me just give you an example. See, suppose we have got two classrooms. In one class, there is 100 students. In another class, there is a 500 students. Now, when from 100 students, 50 are getting their exam cleared, media is reporting 50% student has cleared the exam. Where the 500 students are there also 50 people are clearing the exam, 50 students are clearing the exam. But media is reporting from class B, only 10% student has cleared the exam. Okay, that is what exactly happening in case of vaccination as well. The simple example I'll give you, okay, like India, and you see, you can compare United States of America. Okay, India with a population of 1.3 billion people. Okay, USA is almost about one fourth of that in terms of population. So if India has done 10% and US has done 40%, so if you see the in terms of number, both they have done 130 million people each in their country, because that is the fastest speed which it can be done, which has been set as an example by, you can say, the country where the healthcare system is excellent. So
That's
in my
true.
opinion, yeah. So in my opinion, comparison should be apple to apple. How many people has been vaccinated? Okay, I give you some data which I was going through that. You see,
Please
the
do.
thing,
Thank you.
yeah. If you see that one, okay, in USA population is around 330 million. India is 1.3 billion. Okay, so
Yeah,
India population is 4 times more than USA population. So anything which India does for its people, even if it is at 10%, it is equivalent to 40% of USA efforts. And that what exactly today's figure which says that USA vaccination percentage, whatever has they have accomplished is 40%, 42%, India around 10%, but the number of people vaccinated in both the country are the same. So in my opinion, first that we need to address our rationale and go for the apple to apple comparison. That gives the idea of the real efforts being put by all these government and these countries. In India, with the present leadership of this government, it is doing excellent job. Vaccination, it is going everywhere. And another part is that which I think we need to take a note of this. 65% population of India lives in villages and rural areas. Only 35% population of India is living in urban areas. Always in urban areas, you will find the facilities much better compared to rural areas. Now, if you compare this thing with the USA, in USA, almost 80% population is living in urban area and only 20% population is living in rural areas and villages. So, if in terms of number, India is doing the same number what a developed country is doing, in my opinion, we should say that India is doing great.
that's good to hear. That's very good. Yeah, it's a lot of people who live in India, and you're doing a wonderful job, and you're helping, and you're coming together as a community, and you're doing your best. It's absolutely marvelous.
Another thing
So,
is that if you want to compare, okay, the country like you can say Canada, okay, the Canada, this is the country where the you can say one of the best healthcare system is available with the
wow.
population of 35 million only.
Hmm.
So if we take that one, okay, and if we compare with the population of India or USA, so our vaccination rate is much higher than them, because always we need to go for the count that how
Mm-hmm.
many,
Mm-hmm.
that gives us a clear picture.
Mm-hmm. Mm-hmm. So, what is the situation right now in India? Can you tell us? Are you able to get this COVID-19 under control? And where are you staying right now with what's going on right now at the moment?
You see, it is not only the, you can say, the India, but you can say that entire world. If you see this, the impact of this COVID which is there, okay, in today's situation, I think nobody can predict that where it is going to head, because as we are becoming smarter, virus is also getting more and more smarter. Okay, If you see that COVID version 1, when it was there, the symptom was different, and it was treated by the government, and most of the countries, they have treated it successfully. But as the time passes through, you find that the second variant has come, which is much more serious compared to the first one. Only I think what every country can do in this, and of course India is doing in a big way, that improves the medical health facilities as much as possible, create the more and more hospitals as much as possible, make the required medical assistance like oxygen and ambulance as much as possible. And let me tell you one thing, Diana, that nobody, no country in this world, they have ever thought that the time will come when the demand of oxygen will be so high. Everybody, they will be thinking, okay, vegetable is more important, food grain is more important, okay, medicines are more important. But if you go back just 10 years back or 5 years back, no one has ever thought that oxygen will be so important. Okay. And the thing is that the country which is smaller in terms of population and all that, for them it became a little bit easy to control the things. But where the magnitude of population is so high, like USA, like India, creating those resources, it is a time taking process. And whereby these countries, okay, they are still struggling.
Mm-hmm.
Whereas the country like this one, if you see that Sweden, you see, okay,
Mm-hmm.
Germany, you see, okay, almost they are coming out from such type of problem because of one reason only, that whatever system they were having in place, that was more or less sufficient to cater their population, which is very minimum. Okay, you see that population. If you see that one, uh, um, UK 68 million people. Okay,
Mm-hmm.
so wherever the number of people they were less, it became a little bit easy for them to control
Yeah, that's
because they
true.
could able to, yes, that is a fact, they could able to work on creating those resources which was sufficient for their people. Wherever the population is huge, there the countries they are struggling.
Mm-hmm. Mm-hmm. That's
So
very
only,
true.
yes. So that is the thing only we can say, and that is the reason, where the population is more and all that, the responsibility of the we civilized people become very high to come forward and create a parallel system to assist the system established by the government. It
That's
is a
true.
partnership. It is a partnership to serve the country, to serve the nation, to serve the society.
I'm totally agree with you. That's why I'm telling people don't expect the government to do the whole work. We need to do it together. And we as a human, it's our duty to help each other. It doesn't matter where we are staying in the society. When we come together, we can accomplish anything. Isn't that right?
Of course, that's what I told you that together we make difference.
Yes, yes. And that's why we need this love and compassion and kindness, which is missing a lot in the world, and we need to exercise it more and more so we can bring together and transform the world and make a difference in everybody's life.
Of course.
What is your advice to the world today? What exactly you would like to see change in this world?
See, now, if you compare the world from the last 20 years and today what we are, a lot of things has changed. Okay, entire concept has changed. The thought process has changed. Okay, there was a time you can say when we used to have the joint family. Today we have got the nucleus family. Okay, so what I'm trying to make a point that disintegration in the families happened so fast that one member of the family is in one place, another member of the family is another place, and all those things. Okay, so that is the thing, and for that one, there is a reason behind this because requirement of the human being is changed with respect to the time. Expectation of the people they have changed with respect to the time. Okay, I give a simple example. You see, you find some 100 people having the same degree, same number of experience, but all these 100 people are different.
That's true.
They are not same just because of one reason: their expectation and emotions are different, and their expectation and emotions along with their education decide the attitude of the person.
Absolutely.
Okay, so the first thing is that we need to address the issue of our emotion and expectation. Okay, our expectation should not be such which should make us greedy. our
Thank you.
emotion our emotion should not be such where it becomes the obstacles. We need to be practical.
I love
Our
that.
emotion should be in such a way whereby we should be able to connect ourselves with our fellow residents, our friends, our society. That is today's requirement. That is the requirement of, I mean, today's. We need to connect it. If you see that even in the condominium, and if you see the example in apartment where you are living, next door person do not know who is living and who is my neighbor. Okay,
Yeah.
there was a time. Okay, there was a time, if you go some 30-40 years back, and if suppose you are traveling somewhere and you take one auto rickshaw or whatever the mode of transport available at that time, and just to tell him, I want to go to the house of this person, and that guy, without asking you the address, he used to take you there. That was the connect we had at that time.
I know. I
Today
know.
we are getting disconnected with our own people,
Yeah.
and this is the high time when we need to come together, get united, and make the difference.
Absolutely. I'm totally agree with you. That's what I'm trying to convey as well. We need to embrace our differences. We need to come together. We need to try to find a way to connect with others. It doesn't matter how different they are from us. And this is going to make a huge difference in the society and it's going to bring us together.
Of course.
So we are almost out of time, 2 minutes until the end of the show. Is there something else you would like to share with us? How we can get together, how people can understand how important it is for this acceptance to take place so we put aside all the differences and come together as a team and transform the whole world because we are one huge family. That's how I see things. It doesn't matter where we are in the world. COVID-19 basically showed us that we are one family and every the bad things that happen in one country can happen in the whole world.
Yeah. See, in this, you can say the basic thing which each and everyone should understand, that, and he should think what best I can do for others. My grandfather always used to tell me that the biggest gift you can give to someone is only one thing: think good about him.
That's what my grandparents teach me
Yes.
also.
Okay. You wish for their welfare, you wish for their upliftment. So, first thing is that we need to think good about our neighbor, we should think good about friends, we should think good about the society. One thing we should always keep in mind, and let me tell you, we should do a, always take individually or collectively some initiative. Apart from this, we took some more initiative. Let me just tell you in brief. Okay, we took the initiative to distribute these sanitary pads to all the housekeeping staff and their grown-up daughters. Okay, hygiene is one of the most important factor in life. My wife took this initiative, and every month we used to keep on doing that. Of course, due to COVID, now there is a break because supplies and other things got disturbed. It is not a very big initiative, but doesn't matter. Even if you are able to reach some 200 people around you, that makes the difference. We
Absolutely.
started one initiative through the CSR system from one corporate whereby we used to arrange the uniform, school books, and other things for 400 students of a school. Okay,
Wow, that's amazing.
if you compare this 400 number, okay, with respect to the population of all the students in the world, it is nothing. But it it is a lot for these 400 students. That is the thing which counts.
Absolutely. I love this so much.
We started one fundraising program for the transgenders. Okay, so these are the small initiative. We should say that what we are adding up to the society. One thing which I would like to tell, that is, everyone of us is having the responsibility, and he should and must add the value to the nation, to the society, and to the family. That is the whole purpose of human life. That is what I believe firmly. To add the value to the system, to add the value to the nation, to add the value to the family. That is the most important, because when the family is having the higher values, you'll get the society also like that. And when the society gets improved with high values and principle, nations become like that. So that is a way, I think, way forward which everyone should think about, that how I can add the value to the system, how I can add the value to the society, how can assist someone who need my help. This is the way.
Absolutely. Thank you so much. Thank you so much for being on my show. Thank you so much for sharing this. It's really important for us to come together and make a difference. It doesn't matter who, what kind of a part of the society we are, if we are wealthy, if we are middle class, if we are poor, it doesn't matter. Everybody has something to give, everybody has something to help with, so we can work together and come together and make a difference. I'm totally agree with you. Thank you for sharing these wonderful thoughts. I definitely appreciate. Thank you for what you do, and it
Thank
was
you.
really amazing time to talk to you, and I'm absolutely honored to have you on my radio show.
Thank you. Thank you very much.
Have a wonderful evening. Thank you so much, everybody. Thank you for everybody who was with us. Thank you, Priyanka. Thank you to your wife. I don't know her name. And here is my advice: be love, be compassionate, bring people together, make a difference. Let's get rid of the differences we have. Let's embrace them, and let's come together and transform this world and finish this war with COVID 19, because we can do it. We can do it, and there is always something wonderful coming from the bad things which are happening in our lives.
Thank you very much.